April 18, 2015. I'm Emily Kallgren, your host, and this is Channel 7500 News. Our topics today will include welfare, social welfare, and general welfare. I will cut to a pre-recorded message of myself in the past. Our topic will be examples of legislation. As many people know, there was a bill referred in the House of Representatives on February 12, 2015 that was to amend Title II of the Social Security Act to prevent concurrent receipt of unemployment benefits and Social Security disability insurance and for other purposes. We will be talking about other examples of legislation that have affected welfare. And one example, in prior years, a substantial part of the legislation during the social welfare programs was handled through the reconciliation process of the Omnibus Budget Reconciliation Act of 1993, which became PL 10366 on August 10, 1993. The legislation affected the Social Security and Supplemental Security Income programs was covered in the Social Security related legislation in 1993 and the Social Security Bulletin of spring of 1994. Another act that was influential to the Social Security program was established the Vaccines for Children's program, under which state Medicaid agencies are required to provide for a distribution of pediatric vaccines. And another is the Family and Medical Leaves Act of 1993, was enacted on February 5th, 1993, and it titles employees and family and medical leave for a total of 12 weeks unemployment paid leave per year for the birth or adoption of a child. It also covers the care of a spouse or an immediate family member with a serious health condition in situations when employees' health are unable to work because of a serious health condition. This just in! We have news of protesters outside of a random congressperson's house. Let's cut to that footage now.
Hello, random congressmen. We have a bone to pick with you. The founders expressed a desire to promote for the general welfare in the preamble of the Constitution. They also state in Article 1, Section 8, that Congress has the power to provide for those in the general welfare. However, they disagree about what the phrase general welfare actually means, even though they realize that to some extent they all need to provide for those needs. As the country became more industrialized, the need for more broader-based programs started to arise, such as general insurance program that would protect or compensate workers that were either killed or injured on the job. But this was only on the state level and not actually on the federal level. It wasn't until the 1930s that the Great Depression started creating a need for programs at the federal level. For the most part, people were responsible for providing for themselves, and if they didn't, then they were out of luck. Sucks for you. During the Great Depression, many people lost all of their savings, which was a national problem. In the election of 1932, the Democratic Party took over the majority of Congress. Now FDR became the president. A host of new policies and programs were put into place at that time. They were meant to be temporary measures to improve the economic state of the country, but some people believed that the federal government had a responsibility to actually continue the general welfare. So Roosevelt created the Cabinet Committee of Economic Security to investigate the need for long-term federal welfare programs, which was led to the creation of the Social Security Act of 1935. They were parts to this act: an insurance program for the unemployed and the elderly, and the program for the blind, dependent children, and the elderly, which we stated twice. But over time, the Social Security Act had been amended and changed for a variety of different reasons. That's it.
Back to Emily Kallgren of a different time period. And now, a public service announcement from Lainhart.
Constitutional justification. The constitutionality of social welfare has been hotly debated since the founding of our country. Many of the founders were strongly against social welfare, as they didn't see it within the Constitution's parameters that Congress could make acts of social welfare. And the most hotly debated statement was the General Welfare Clause, in the preamble, and then in one section of the Constitution it says general welfare. General welfare is defined as the state of well-being, and so That could mean many different things depending on your personality and how you see it. But the General Welfare Clause says to lay and collect taxes to provide for the group well-being of all the United States. James Madison was quoted with saying, "I cannot undertake to lay my finger on that article of the Constitution which granted a right to Congress of expending on objects of benevolence the money of their constituents." James Madison, with that quote, we can clearly see, as the father of the Constitution, did not think that in the Constitution there was any clause or parameter which allowed Congress to make acts of social welfare. But that's not all. President Cleveland was quoted while saying, "While vetoing an act of social welfare, I cannot find no warrant for such an appropriation in the Constitution." Thomas Jefferson also said, "Congress has not unlimited powers to provide for the general welfare, but only those specifically enumerated. In these, Washington must not be encouraged to interfere." But we know that FDR later went back on these words. As we can see, many notable people that we look up to and quote many days in our lives did not think social welfare was constitutional. However, the issue of constitutionality of the Social Security Act came before the court in 1937, where it was deemed constitutional.
Are we done?
Though, even though it was deemed constitutional, many people still debate it, though many more acts of social welfare have been passed since. And it continues to this day.
Look at an illustration of all of the members on the Social Welfare Committee from the House and the Senate by Bailey Kersey.
All welfare legislation comes out of a committee of appropriations, and more specifically a subcommittee on labor, health, and human sciences, education, and related agencies. There's one committee and consequently one subcommittee for each House of Congress. So there's one for the House of Representatives and one for the Senate. The House of Representatives has 12 members, with 8 Republicans and 4 Democrats. And the Senate has a 9-to-8 ratio, equaling 17 members. And there is one name for the Senate that doesn't get put on this list. Tammy Baldwin is a Democrat from Wisconsin. Starting with the House of Representatives, Tom Cole is the chairman, and then Rosa DeLauro from Connecticut is the ranking member, and Tom Cole, I think I might have skipped that, is from Oklahoma. It's on the picture. But the chairman is basically more or less a moderator. They delegate responsibilities, they prepare items for ballot, and they're the highest ranking member of the majority party for that specific subcommittee or committee, depending on which one you're talking about, because the committee has a chairman and ranking member, and the subcommittee also does. And the ranking member is the highest ranking in the minority party. So the Republicans currently have control of both House and Senate, so they have the chairman for both of the subcommittees, and then the Democrats have ranking members in both the subcommittees. Moving on to the Senate, Ray Blunt from Missouri is the chairman, and Patty Murray from Washington is the ranking member. Ohio has no members on either subcommittee, the House or the Senate subcommittee. But some states have more than one member. When Republicans from Oklahoma and Tennessee, there's one in House and Senate, so they're represented in both sides of Congress. The Maryland and Pennsylvania and Illinois each have one Republican and one Democrat. Maryland has one in the House and one in the Senate, a Republican in the House of Representatives and then a Democrat in the Senate. But Pennsylvania and Illinois are both limited to one House. Pennsylvania's are both in the House, and then Illinois are both in the Senate. And then California has 2 Democrats represented in the House of Representatives. And overall, there are only 13 states that are represented in this subcommittee.
This just in! There are more protesters outside of the same congressperson's house! Let's cut to that footage! We're back! And we brought more people!
There are lots of many different social welfare programs. These programs fall under 4 different categories: social insurance programs, health services, food and shelter programs, and other voluntary sectors that are not in non-profit sectors. These programs include social security, unemployment insurance, workers' compensation, and temporary insurance for needy families, which actually isn't very temporary, supplement insurance, income, Medicare and Medicaid, and public housing, Section 8 housing assistance, United Way system, also known as community chassis monopoly. For more details, now it's important to note that when Social Security was first created by FDR, they wanted to implement programs like Medicare and Medicaid, but the idea was too controversial at the time, so it didn't actually happen. Then when LBJ became president, Medicare and Medicaid programs actually became a thing. In case you were wondering, Medicare covers most hospital and medical costs for people aged 65 and over, or for Social Security disability, and is the second largest program in the domestic program. It's second only to Medicaid, which helps to finance health service care for the poor. The end.
It's from our sponsor, Tyler Smith.
Okay, so obviously as Obama's a Democrat, he finds welfare important and he thinks we should support it. Now under his 6 or 7 years in the presidency, we've grown that 33%. And number-wise, that's like $650 billion more, or no, not more, but $650 billion that we spend each year on welfare. Now this goes up even to $1 trillion based on states' welfare programs. And then on top of that, Obama just in general defends social welfare, like such as our New Deal politics, you know, all of our economy boosters. Now, some of the things that he's actually done is he's just done, like, during his early presidency, he's done some low-income assistance, just helping people who have, like, baseline jobs to get living. Alright, so then after that, like, his first major thing he did was he did a stimulus package, which was the, what is that? The Recovery and Reinvestment Act, which was in response to our, not depression, but I can't think what that's called. Recession, yeah, it was in response to our recession. And then it was just, as soon as we hit the recession, he just started flooding it. He said we needed more jobs out there, and that was his stimulus package, was stimulating the economy. After that, the biggest thing he did, and the most controversial probably, was the Affordable Care Act, also known as Obamacare. And that was boosting the economy, or not boosting the economy, but getting welfare out to everybody, upping federal standards for it, and that obviously caused some controversy between the Democrats and Republicans, and even some of the Democrats themselves, because people thought there should be varying levels of support and, not support, but regulation within the government. And while this doesn't really replace Medicare or anything like that, the Affordable Care Act did that. And yeah, that's all I have to say.
And in conclusion, I would like to remind you that everyone is a stakeholder of social welfare, because although you might not be a recipient of it, you still pay into it.